President Joe Biden's recent positive COVID-19 test serves as a stark reminder that the pandemic is far from over. As millions of Americans embark on summer travel, the risk of contracting the new Florida variant of the virus remains significant. The Centers for Disease Control and Prevention, CDC, has identified high COVID-19 levels in approximately 8 states based on wastewater treatment site testing, underscoring the continued vigilance required to manage the virus. In New Jersey, COVID-19 levels in wastewater are currently categorized as moderate, according to data from 16 testing sites as of July 18, per the CDC. Neighboring states show varied levels of the virus. New York reports low levels, Pennsylvania is moderate, while Delaware and Maryland are experiencing high and very high levels, respectively. Connecticut also falls into the very high category, indicating significant regional variability in virus prevalence. Recent data from the New Jersey Department of Health indicates a surge in positive cases, reaching their highest levels since winter. With the rise of at-home testing, the CDC highlights wastewater testing as a more reliable method for assessing community spread, as it can detect the virus before individuals seek medical attention and identify asymptomatic cases. This method provides a clearer picture of COVID-19's impact on communities, especially as people continue to travel and gather. For the most at-risk populations, including the elderly, immunocompromised individuals, and those with other medical conditions, vigilance remains crucial. Andy Pekas, an immunology professor at Johns Hopkins University, emphasizes that while current variants do not present new symptoms, the milder disease seen today is likely due to stronger immunity built from previous infections and vaccinations. This enhanced immunity enables many to fend off the virus more effectively, reducing the severity of symptoms for the majority. The CDC continues to recommend vaccination for everyone aged 6 months and older. The updated 2024 to 2025 vaccines from Moderna, Novavax, and Pfizer are expected to be available later this year. Data from the 2023 to 2024 vaccination period showed that those who received the vaccine had greater protection against the virus and hospitalization compared to those who did not. Staying up to date with vaccinations remains a critical measure in reducing the risk of severe illness. Travelers are advised to take precautions to minimize their risk of contracting and spreading COVID-19. The Mayo Clinic suggests updating vaccinations a few weeks before travel, practicing regular hand washing, wearing face masks in crowded areas, and opting for outdoor activities when possible. Maintaining physical distance from others indoors and staying home if symptomatic, awaiting test results, or diagnosed with COVID-19 are essential steps to protect oneself and others. As the pandemic continues to evolve, it is imperative to stay informed and adhere to recommended health guidelines. The persistence of COVID-19, especially with the emergence of new variants like Florida, necessitates ongoing efforts to safeguard public health. By following vaccination recommendations and practicing preventive measures, individuals can contribute to controlling the spread of the virus and protecting vulnerable populations.